Hello, I'm Dr. George Lundberg, and this is At Large at MedPage Today. The status quo in American healthcare is unacceptable. Everybody knows that. Way too expensive, far too inefficient, gross defects in patient safety, uncoordinated, rife with access and reward disparities for patients and providers alike, an international statistical embarrassment based on population outcomes. The United States Congress, the President, and now even the Supremes have spoken conclusively with their own voices of disparity. The Patient Protection and Affordable Care Act, PPACA, isn't the bill I wanted. It may also not be the bill you wanted, but the status quo of American healthcare is unsustainable, and the PPACA is the bill we got, the first really major change in American healthcare law in nearly 50 years. Here's why you should support it when fully implemented in 2014. 1. Many millions more of Americans will have comprehensive medical insurance, no denials for pre-existing conditions, no lifetime or annual limitation of benefits, affordability by community ratings. This means that cost shifting will decrease for hospitals, and physicians shall have a smaller patient base in need of pro bono care. 2. For the vast majority of states, many millions of poor people, including men and adult women, will become newly eligible for Medicaid because of the increased and nationally standardized income level at 133% of the federal poverty line. 3. Medicare beneficiaries will see improvement in their prescription drug coverage and free care for preventive practices that have been shown to be beneficial, all as part of new patient-centered approaches. 4. New research into effective practices to prevent and manage chronic diseases will result in improved lifestyles and individual healthy behavior. 5. Primary care will be enhanced and expanded by workforce changes, financial incentives, more community health centers, and the National Health Service Corps. 6. The new Patient-Centered Outcomes Research Institute, PCORI, will perform and support research into the comparative effectiveness of various diagnostic methodologies and treatments, and the Agency for Healthcare Research and Quality, AHRQ, will continue to facilitate the translation of this new knowledge into daily practice. 7. New research will examine what changes in the handling of medical liability, such as tort reform, could be implemented that would actually help solve the problem of medical malpractice and defensive medicine without harming patients who have been harmed by malpractice and deserve relief. And there is more, but that is a lot. Perfect by no means. If, when fully implemented, the PPACA can result in a vast improvement in the U.S. healthcare non-system, and it can be incrementally improved upon. Good news for the American nation. That's my opinion. I'm Dr. George Lundberg at Large for MedPage Today.